Why do I need to see my GP?
People with learning disabilities often have other health conditions, such as asthma, diabetes, or ADHD. The sooner you spot them, the sooner you can treat them. It is important to visit your GP because you might have a condition or an illness and not know about it.
You could have an illness no matter what age you are, young, old, middle age.
What is an annual health check?
Anyone who is older than 14 years old and has a learning disability can have their annual health check, which is an appointment with your GP.
It happens every year, yes, and it is free. Usually lasts for 1 hour.
People go to their annual health checks to seek medical advice if they have any problems with themselves and get the support they need.
Because I think it's very important people go to the surgery regularly.
I can, because I've got learning disabilities, so...
How do you book your appointment?
Sometimes they will send a letter to you, and if they don't, by all means give them a call or email them yourself.
As soon as the letter comes, phone them and say, when can I have my appointment?
Sometimes they call me if I have to go in, or I can do the appointment via my phone or my mum's phone.
If you need some help, ask a friend or a family member or your support worker.
What are reasonable adjustments?
It's okay if you need to ask for a special arrangement.
When you get to the surgery, make sure you tell the people what you need in order to have a good experience. For example, you can ask to come back at a quieter time, or ask for extra time. And tell them which method of contacting you prefer, be it text, call, email, or letter.
They send a letter to the doctor and a letter to you. I ask them to put a yellow mark or something over the importance so that I could read it, and bold so that it won't affect the eye, that I can't see out too well.
What do other people do to have a good experience?
Before you go in, just take a little breather, yeah? Or watch something to keep your mind off it. Sometimes I would listen to music to calm myself down, or watch something on my phone. Like go on YouTube and watch a few videos. What else? Look outside, yeah, if they have a window out there. Or just, they've got a few newspapers that I could read, so I can catch up on that as well.
Everybody's different. I get discomfort sometimes, so I decide to take the taxi to make sure I'm there, because I come really early in the mornings to the surgery because it's over and done with, and I haven't got to worry too long about it.
Or you can bring anyone you trust, like a carer or friend or a family member who really understands you.
Maybe you can talk to your support worker and get it all sorted, so you've got someone with you.
Sometimes I will go by myself. Sometimes I will go with mum. My brain shuts off. So when my brain shuts off like that, she's like a backup, yeah, to help me.
I went with my dad because any question that I didn't know how to answer, my dad was there to answer it.
Yeah, I invited Mum to remember what was said.
Even when I haven't got anyone to be with me, I go because it's important.
How do you travel to your appointment?
Plan the journey a few days beforehand.
When I have an appointment, sometimes I get there by bus, or sometimes me and my dad just walk it. Sometimes I do know my own way to where I'm going, but sometimes I rely on my dad as well.
Well, I would use an app and I plan a journey beforehand. Like a few days beforehand, check the routes and see which one is the best to get to where I need to go.
If you're bothered or you can't walk very well, that you're having difficulty, they will book the taxi, but you can also talk to the doctor if you want to, your GP, to make sure it's done, because sometimes they can book it and you've got to be sure that it is booked.
What happens during an annual health check?
Sometimes you'll only have to do your annual health check with a doctor or a nurse.
Well, they check your health if anything's changed.
They'll ask you questions, check up on how you're feeling. Then they'll ask you questions about any pain you may be feeling recently, your life, your health, your lifestyle.
In my last annual health check, they used to take my blood pressure, they used to take my height and weight, and they also asked me questions about my medication.
They will listen to your chest or your heart, and also they can feel your stomach.
Check if I'm eating right, yeah, stuff like that. Check my blood pressure.
They will ask about your existing health conditions, the medication. If you need anything, just ask them. If you want to stop, just tell them. Together, you will make a health action plan.
What is a health action plan?
A health action plan is a document written by your GP that tells you what do you do to stay healthy to reduce any health conditions. Please tell them if there's anything you don't understand, or you can ask them questions.
The annual health check will make sure that you're healthy, and it will spot any medical conditions early on before they become problems. The Action Health Plan helps you remember what you need to do in order to make sure that you stay healthy. After your appointment, you may need to make changes. Change your medication, change your lifestyle. You may need to go to another checkup with your GP. Everything you need to do though will be written on your Action Health Plan. So make sure you check it.
What happens after your appointment?
Sometimes I have other appointments afterwards.
GP or nurse will make referrals to other services.
My appointments are sometimes video, sometimes I have the MRI, sometimes they take blood test.
It's delivered my medication, so delivered to my home. I have gone and got it. Sometimes I think you've got to be strong and go over and get it anyway.
Call your GP now to book your appointment.
It's best you go, because it could defend issues, and they may pick up something you haven't noticed.
And that's about it really. Thank you very much for listening.